I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And thank you very much for allowing me the privilege to enter in a conversation with you and share information that I have and share what I have learned through more than 50 years as a physician and what I have seen and what I have dealt with when you're dealing with chronic degenerative disease. I know aging is a fact, is part of life. But as an old patient of mine always told me, I don't mind dying, doctor. I know one day I have to go and go home and meet my creator. But why do I have to be sick before that? And when you look at the natural way of dying, we just should kind of fade away. You don't have to be sick, you don't have to go to a doctor, you don't have to be taking drugs, you don't have, probably the last few weeks or something like that, but not for years, as it happens today. And when I deal with people, and with the experience that I have, and with patients that have heard my advice long time ago, years ago, and I can see the difference, then I say, I have to share this. I have to spread the word. And I'm not the only one. There are many people that are spreading the word about it, and I will give you some information about it. But it's very important that we sit and think, how do we want to live our future years? It's the same as retirement. When you think of retirement, you see about your 401k, you check your bank accounts, you see what investments you have, brace if you're with the stock market, but nevertheless, you are making provisions for the future. You're planning your life for your older years, for your after retirement and so on. So you say, I'm going to need about this much money. I have to send my children to the university, through college. I want to make sure I can make that trip I always wanted to do with my wife and buy or rent a motorhome and go right across the country. We all have those plans. We all have thought of that one time or another. And we say, what about if I go to Hawaii or to any island in the Caribbean and just enjoy like a long vacation when everything is freezing home? I could be with my shorts and an open shirt by the ocean, etc. So we all think of that and we plan. That's the most important thing. We plan how we are going to get to that point. And you say, okay, I make this much, and I will not have enough money if I want to travel like that, or if I want to buy a motorhome, or simply if I want to stay home and worry about nothing, because I have enough to pay my rent, to pay my gas, my electricity, my car, my everything, and keep my family happy and fed. Well, yeah, we all plan for that. But why don't we start planning our health for the future? And the same way you make a 401k investment, the same way you buy some stocks, or the same way you do any of these things, you can start thinking, where do I want to be when I'm 50 or 60 or 70 or 80? I want to think where I want to be health-wise. Because even if I do a fantastic financial planning, well, I might not have the health to do it. What if at the time where I can afford time-wise, because for many of us it's time what blocks your plans. For many of us it's not enough money. And money, yes, we can plan, and time too, because you say, well, after retirement I'm going to have the time to do whatever I want to do. But what if at that point in time I have a heart attack, I have a stroke, I'm diabetic and I have to go to the doctor frequently? What if I'm on kidney dialysis and I have to go to the hospital 2-3 times a week. You won't be able to travel. Besides, you're going to be spending a lot of money in doctor's visits, hospitals, medication, medical assistance, and so on. So, yeah, I'm planning my financial life in such a way that I'm going to be in good shape when I'm 60 years old or 70 years old, but I want to make sure I'm going to have the health to enjoy it. And for that, I have to start earlier. And the earlier the better, just like saving money. I have always said health is managed the very same way as money. You can save health for the future. You can have health deposits that allow you to withdraw from that savings in case of need. And we saw it in COVID-19. We saw that many people that were healthier, that were in better shape, that had small or no health compromise of any kind, did a lot better than those that were already compromised. Again, just like money. If there is a big economic turbulence around us and you have money saved, you're going to be able to draw from that and be resilient. But if you have no money whatsoever, you don't have any funds to help you out, well, you might lose your car, you might lose your home, you might lose a lot of things because you had to sell them or because they were taken by the bank or whatever. So it's just like money. Health has to be saved. Health has to be planned. Health has to be an asset that we can contribute to every day, just as any saving fund, in order to have what we need when retirement or when anything happens. And again, we saw it in COVID-19. Those that had better health resources did a lot better than those that didn't. And again, same like with money. So it's very important that we sit and plan. I have seen on the television, for example, many ads when they talk about investing in this or investing on that and securing your future and buying health insurance, etc. And I always get the picture of somebody sitting at the kitchen table, wife and husband, talking about it, papers on the table. And you have seen the ads. You have seen on TV. And you see these ads where people are sitting on the side, and then the ad says, you can call us, you can get advice, we can tell you how, we can offer you this or that investment, etc., etc. But the picture is a family together at the kitchen table, papers on the table, planning what we want to do for the future. And I invite you, I urge you to do that. I urge you to plan this coming Saturday. Whatever is the next coming Saturday, make a plan. Get your wife, get your children, and talk about it and say, look, I'm 40 or 50, and what about if when I'm 65 we buy a motorhome and we go cross country? Or what about if we buy a second home by the lake? What about anything? And then you say, we're going to need this much money, etc., but we're going to need this much health. I have to be healthy because after all, the most important asset, and I'm talking money here, I'm talking money, hard money. The most important asset that you can have is not saving, is not stock market, it's not anything but your own health and performance. Because you're the bread taker, because you're the one that produces everything that you have at home. You're the one that produces everything that you enjoy, and you have to save some of that for the future. So your health is an asset. Not only it is an asset, but it is the most important asset that you can have. Health means money. Health means prosperity. Health means resilience and survival. So don't take it lightly. I'm not talking about, well, yeah, I'm going to be aging and I might have some problems and I'm not going to be as good as when I was younger, etc., etc. That all is true. I just recently met at a mall a very good friend, and I asked her how you're doing. She says, well, I'm not the one I used to be, but I'm okay, doctor, thank you. And I said, you know what? Nobody is the person you used to be, even if you're young. Even you're, let's say, in your 40s, you don't perform as a 20-year-old. You don't perform as when you were a teenager. So yes, we all change. Yes, things will gradually begin to decline. But you don't need to climb a mountain anymore when you're 70 years. But yes, you want to mow your lawn, you want to clean your house, you want to make a trip, you want to go and visit friends and for Thanksgiving. All that you want to do and have a beautiful Thanksgiving. You don't want to spend those days in a hospital or in a doctor's office. You want to use your money to ask your family, jump in the car, we're going to Wisconsin, let's visit our friends and family and spend a beautiful Thanksgiving. That's what you want to do. And this is what we're going to be talking about. And we're talking about also, going to take the opportunity to talk about a silent killer that might be already inside your house, that might be sleeping with you, with your family. And if you don't do anything, it's going to be very costly. So stay with me, because I need your undivided attention. I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. I have been a doctor for over 50 years, and I have dealt the vast majority of that time dealing with chronic, inflammatory, degenerative, aging diseases that are really taking the biggest toll in healthcare in America today. More than half, actually 7 out of 10 people who die in America today, 7 out of 10 die because of these causes. And the other big problem that I have is that they get these diseases at a younger age than what used to be. When I began as a doctor, I remember that you would say, well, this person has cancer, and you would say, oh yes, it's 85. Like it's about time. But today, they tell you, you know what? Our friend, our neighbor, or whoever is 35 years old and has breast cancer. What has happened? And it's not an isolated case. And I'm not asking you to believe me. I'm not asking you to go and read the papers or look for information. I'm asking you to talk to your co-workers, to your friends in church, to the community in general, your family, and you're going to see that we get this news every now and then. So we're getting a problem. And that problem is creeping into the younger part of our society. And you, who's the younger part of our society? Our children. Our grandchildren. My mother always talked about death. I remember she telling us, one day I'm going to die. So you have to know that. But what I want you to know is that it is only natural that one day you're going to go to my funeral. So think of me as going back to my father. So don't worry. Keep on living. Get on your life. Get with everything you're doing. And I'm going to be happy if the day I die, all my children are around me and healthy. Because what I would not like to see is one of my children dying. I don't want to go to their funeral. There's not even a word for it. When you lose your parents, you're an orphan. When you lose your husband, you're a widow. But there's not a word for a mother that loses a child. So we have to be very conscientious about that. And if we love our children as we claim we do, stop saying, I love you. Show it. Show it with better nutrition, with better care, with better surveillance. We need surveillance. We have to see what's happening in order to find out if they're healthy or not. Show them better ways. Choose foods. Take them, ever since they're young, take them to the supermarket and say, look, these are veggies, this is this. Look at this product. We're looking for grass-fed dairy products because I know cows should be eating grass, not grains. And the same goes with hens and eggs and so forth. It's the contrary. Chicken should be eating grains, not fish. So we have to make sure we not only read the label, we find out where the product we're about to eat comes from and how it was raised. So it's not the same, a farm fish, than a wild-caught fish. So, and you have to learn about it. And we have so many resources for that it's kind of easier and easier to get a lot of information. But share it with your family. I was talking about sitting at the kitchen table with your whole family and talking about these things. It can go a long way and can be very, very profitable health-wise. So one of the biggest killers we have in America today, a huge killer, is completely silent. There is no way. You don't know you have it. You have to go after it. You have to chase it. You have to wonder whether you have it or not. And frequently, not just every 5 years. No, but every 6 months you have to wonder. If you have any little symptom, like a little bit of dizziness, or a little bit of nausea, or if my equilibrium is not good, or if I have frequent headaches, anything, I have to make sure I check it, because it's inexpensive, it's simple, anyone can do it. You can do it. And that's high blood pressure. It's called the silent killer. Because many people find out they have high blood pressure the day they got a stroke, the day they had a heart attack, the day they had a burst in an aneurysm in any blood vessels of the body, and you die because of the hemorrhage. But this is something that had probably been lingering in your body for many years. High blood pressure, you can get it at fairly young age. And once again, we're seeing high blood pressure in younger people. So don't think that because you're in your 20s or 30s, you do not or you cannot have high blood pressure. You can go to any pharmacy. You can go to any pharmacy in the corner of your street and buy a pressure reader, a blood pressure reader. And then you can go home and do it yourself and check it out. And It is not 100% accurate, but if you find anything that you don't understand or you don't like, then go to your doctor and he's going to do it the right way. And he's going to confirm that you are healthy, great news, or that you have a problem. Great news again, because now you can act upon the finding. You're not going to wait until the day you have a stroke. You can start acting today. And the other important part of this is not only you are discovering the enemy, you're unveiling who's behind, trying to get you. Now, the next good thing is that you have a lot of tools to control it and to defeat it. So it's not only an excellent diagnosis, but it is the beginning of a lot healthier life, because you know you can control it, and because control of high blood pressure is within your reach. So when you have those possibilities, the big question is, why don't we are more careful? Why we are not aware? And basically it's because of lack of information. When I was telling you that the same way we have to plan finances, we have to plan our health for the future, those are the things you have to know. Those are the things that you put on the table on papers and you say, I want to be healthy when I'm 50 or 60 or 70 because these are my plans for the future and I need my health to do it. Then, when you're doing all that, remember the TV ad I told you? That there is a voice that says, you can call us and get more information about this plan or the other plan or stock market or any form of investment? Same here. You're listening to me. And I'm in the social media of your choice. And I'm on Facebook and Instagram and you name it, more sites that I can remember. I have a web page. I have a toll-free number and a direct email that I answer personally. So when in doubt, all you have to do is ask. I would love if you follow me. If you follow me with these podcasts and blogs, because all this information is available in written. You can request a PDF about it. But you have me on your side. I'm your ally. And you don't have to pay for it. I love to give this advice because I don't want to meet you as a patient. I want to meet you as a passenger in a cruise boat and say, Dr. Rodriguez, and it happened to me many times. When say, Dr. Rodriguez, I have heard you for many years, I have seen you on TV, I have heard about your work, and I did these changes, and I'm happy for that. Well, that makes my day. That's what I want to do. And I have met people in Paris, and I have met people in a cruise ship, and I have met people in a zoo, people that come to me and say, I heard the message, I'm doing it. They paid nothing. And they're saving a lot of money. So the more you know about yourself, the better you can implement a surveillance system, awareness, vigilance, to make sure that at the earliest onset of any problem, you can start acting upon it. Because if you do, it's going to be inexpensive. It's not going to cost you much sacrifice. It's not be so radical of a change. You will not have to go to the lab or anything like that. I was telling you, if you check your live blood pressure, your blood pressure, all you have to do is get one of those little gadgets that you can get in any pharmacy. Do it yourself. You didn't buy anything else. You didn't have to take medication. You didn't do any blood work. You didn't have to have a doctor's visit or anything like that. You know you have that enemy in your body. Now, yes, now it's the time to go to the doctor, make a plan, start controlling the problem and learning about it. But there's so many things you can do, so many things you can add to your well-being before anything the doctor can tell you, that I want you to stay with me, follow me, because we're going to talk about that, and that is very important. My dear friends, I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today I'm very passionate about this subject, the things that I have to discuss with you. Let me thank you for having this conversation with you, for listening to me. But it's very important that we do several things in our life if we want to enjoy it to the fullest and to the whole extension of the life. Because not only living to the fullest, that you can do if you go to any big party and smoke things and drug yourself and drink yourself, etc. That is fantastic, and you're going to feel great, but nothing is going to happen later. You're going to be sick and you're going to be paying for it. So you have to do something that makes you enjoy your life today and for the whole extension of your life. Whatever number of years God gives you, you want to be in good shape. You want to be able to perform. You want to be able to enjoy. And you plan your money, but you have to plan your health. Don't waste your health. That is just as bad as when you waste your money. Your health is earned, same as your money. You earn your health through the way you live. So there is an unequivocal connection between your lifestyle and chronic degenerative diseases, and in particularly high blood pressure. If we start learning that, if we start paying attention to that, we are going to bend the numbers. So we're going to bring them down. We're going to control the whole situation. We're going to be spending much less money in kidney dialysis or people with strokes and so forth, because we are going to curve the numbers. And that's what I want you to do. Now, we have talked already about this deadly epidemic of chronic degenerative diseases. We're talking that 7 out of every 10 people are going to die of any form of chronic degenerative disease. But I have told you that it takes very little to find out, and that the first rule that we have to meet is surveillance and vigilance. We have to be checking our blood pressure in your family, your spouse, or your friends, and say, hey, look, I bought this little gadget, let me check your blood pressure. And little bit playing, little bit being serious, you can start detecting blood pressure problems in the people around you. Take it to your workplace. Take it to your church. And start thinking of that. And you might be surprised of people that you did not suspect, that they did not suspect themselves they have high blood pressure, that are going to find about it. Then, yes, it's the time to go to the doctor and see how advanced, how serious, what other organs have been affected, because it can affect everything. It can affect your limbs, it can affect your kidneys, it can affect your heart, your brain, many organs. So then is the time to go and talk to the doctor. But there are things that we have to take attention to. And I'm going to post just very simple situations which you have to take care of in order to start curbing your risk or treating if you have high blood pressure already. You can have either one. You can have high blood pressure, and the same thing that's going to help you to prevent is going to help you to treat successfully. Let's start with number one. Number one, because it's a huge epidemic in our world today, particularly in America, is overweight and obesity. 2/3, that means 2 out of every 3 Americans carry more weight than what they should. It is really a somber outlook when you think of these numbers. And it's not because you don't look good. It's not because of cosmetic things. In other words, if you have a liposuction, if you have a bypass, if you do a lot of these things, you might not be solving the situation unless you change the way you eat. And many people that I have seen, for example, that have engaged in bypass or bariatric surgery, they improve not because of the surgery. They improve because they change their lifestyle. They don't eat the same amount, and they do not eat the same thing. But those that refuse to make the dietary changes continue to be sick forever and obese forever. So I know many people that, they go to chocolate and ice cream. Why? Because both of them function in the body as a fluid. Chocolate melts and ice cream melts. So they function like a fluid. So no matter how much surgery you have, you can take as much chocolate and as much ice cream as you want with its sugar, with its bad fats, with whatever problems. Those people might get sicker than before. But those that are successful, it's not because of the surgery, it's because of the lifestyle changes. So why do I want to go through a surgical process if I know that my dietary changes can be enough? So I want to plan that. And once again, call me, write me, contact me, and say, Doctor, I want to change. Where do I begin? And the problem with obesity and the problem with overweight is not, again, the looks. It's not cosmetic. It's because it tells me a story of bad nutrition. If you eat right, if you balance your calories, if you eat good food, you grow, you get stronger, you don't get sick. But if you eat, for example, a lot of sugars and so forth, and you tend to go to a diabetic condition, then you lose the capacity of insulin to promote growth and development. So your body is going to be going down. It's going to be receding. It's going to be damaged because insulin cannot do the job anymore because we're eating a lot. There are many biochemical, metabolic reasons why doing that is so bad to the body. And one of the important consequences is high blood pressure. Why? Because that type of nutritional pattern can bring inflammation in the blood vessel. Inflammation means a loss of caliber. And if you reduce the caliber of the blood vessels, the blood pressure is going to increase. That also brings increased thickness of the blood. Density of the blood will go up. And as you do that, the blood pressure will go up. So now you have very understandable and logical factors of why this lifestyle is going to bring my blood pressure up. And the higher the blood pressure, the less blood flow we have. It sounds a paradox, but it is the way it happens. Because you say, well, I have a higher blood pressure, that means I'm going to have more blood flow. No, the high blood pressure is because the heart is trying to fulfill a demand of the body that doesn't get enough oxygen, enough nutrition. And by raising the blood pressure, it can only increase the inflammation, and it can only increase the damage to the blood vessels, so the blood supply is going to go lower and lower and lower. And one of the organs that suffers the most is going to be the kidneys. And many people lose their kidney function because of high blood pressure. And that's the beginning of the end. Once your kidneys fail, there is going to be a domino effect. Then your heart is going to start failing, your brain is going to start failing, your lungs are going to start suffering as well. So think again. Obesity and overweight is 2/3 of the American population. What can we do to fight it off? That is so critical, so important. Second factor is sodium. Sodium, not salt. Sodium is the culprit of high blood pressure. And sodium, of course, is in salt. But let me tell you, simple. If you have sea salt, you're having 15% less sodium than table salt. Just by changing the type of salt that you have. Just by going to sea salt. Once I take care of the following question. Himalayan salt, it's sea salt. Okay, it's all seabed salts. So change that. That's going to be easy. Reduce the amount of salt. Be more sensitive about it. And with those two changes, you're going to begin to see good things happening in your body. And the third one, physical activity. Remember, any exercise, whichever exercise you can do, is better than nothing. Walk in the mall. Walk in the parking lot. Go upstairs and down at home. Vacuum your house, moving furniture and doing a lot of things. Mow your lawn. Walk around the block. But make sure you incorporate 30 minutes of physical activity to your life minimum. Simple things, just 3 things that will start changing your life for better. Go to your kitchen table. Get the family together and say, look, I heard this. It's in every social media of your choice. Listen to part of it. Read it. You can request a PDF. And start making your plans. And remember, you have a friend. Call me, and I will be behind you. So don't go anywhere, because we still have things to discuss. Well, my friends, this has been a rather interesting chat I have had with you today. And I have been very passionate because I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, and I have over 50 years of experience as a doctor. And I'm very passionate about it because I have seen what neglect and disdain for healthcare can do to your body, to your health, to your wallet. I don't have many arguments against you, because I know that a lot of that neglect and disdain is not because you don't care. It's because nobody told you. As a good friend of mine always says, the problem with humans is they never gave us an owner's manual. So we don't know what to do, when to change oil, when to rotate the tires, when to balance the wheels, etc. So that is the problem. Well, I want to be your body's manual. I want to tell you what to do. I want to share what I have seen and learned through more than 50 years of medical experience. I have seen all sorts of things. And I have to repeat this over and over again, that every day I meet a patient where I think, I wish I would have seen him 30, 20, 10, 5 years, 2 days ago. But it is, number one, we take our body for granted. And we think that we're entitled to. We have this sense of entitlement. I hear it all the time. People go and buy a 16-ounce steak and then say, well, I'm worth it. It's not a matter of worth or not worth. It's a matter of, is it good for you? Do you really think that a normal human being that drives in a car the whole day and sits in an office for 8 hours and then watches TV sitting in a couch can use and digest successfully 16 ounces of beef with a baked potato, with a couple of liquors and red wine and a gin and tonic and the whole thing, and smoke a cigar without any damage? We have a very resilient body. We were created in perfection. But we were also given the rules. We were told how we should keep our body healthy. You can read it. It says, and I give you these plants and trees and fruits and animals and fish in the ocean to feed and nourish your body. But we don't do it. We just have, again, this entitlement that, oh, I should get all this because I can afford it. Eating has become in many ways an economic issue. If I have money, I can have 16 ounces of beef. Well, think again. You might have an 8-ounce beef and still enjoy yourself, but be healthier. And then you will be able to have 8 ounces of beef for years to come. Instead of being intravenously fed in a hospital bed because you have a stroke and because you cannot communicate, or because you have to go to the hospital every so often because you have to do kidney dialysis, or because you have to be on a wheelchair where people pull you out to the balcony just to get fresh air and go back to your room. Think again. Would you rather have 8 ounces of beef and enjoy your life, or have this big piece with alcohol, with big desserts and everything, and smoking, and just enjoy it for a short period of time? It is just a matter of being logical. And if you're logical, you know that you can indulge only so much before you get into trouble. And it goes again for money. It's exactly the same thing that I've been telling you all along. Think of health the way you think of money. You're going to just throw money away. No, you have to spend money, and if you, instead of spending money, you invest your money, you're going to have in return more money than if you just throw it away. I mean, you could, if you have money, you could just go out to your local airport, rent a plane, invite all your friends to Vegas for the weekend, and throw $200,000. What you're going to have the next day is a hangover and much less money in your bank account. But if you invest $200,000, you might have $250,000 in certain time. Same with health. If instead of throwing away your health with a big cake and ice cream and bad food and drinking and smoking, well, you're going to end up getting nothing. So we have to be logical. We have to be a little bit more frugal with our life because we want it to last long and we want to enjoy it all along. I want to enjoy my life to the last day of my life. And the only way I'm going to do it is by being careful, watchful, by being aware and have vigilance in how my body works and how my body reacts. And yes, I can have my cake and eat it too if I follow those rules. I might not be able, or not, yeah, I'm able to, but I don't want to eat huge amount one day and be sick in the future. I want to enjoy my life all along. So we have to do that. And the most important rules are within our reach. I want to take a minute to talk about a book that I have read that I loved. 30 Days to Natural Blood Pressure Control. It's by Dr. David DeRose. And I like this book, which, by the way, you can get the link on how to get it. Simple reading, easy reading, is because it explains a lot of the things that I'm talking about, and it gives you simple rules to change your life for better. If you were to follow the rules in this book, you might decrease your risk of a heart attack, decrease the risk of diabetes, decrease the risk of heart disease, decrease the risk of many things, including cancer, and of course, high blood pressure. Because it's a reasonable approach within our reach. See, if we consider a lot of the problems that we're getting today are because of our lifestyle, because if we accept that there is an inequivocal connection between the diseases that we're looking at the most today and disease, and lifestyle, if we connect the two, lifestyle with disease, then we have to understand, and it is only logical to think that by changing our lifestyle, we can improve our health. Now, here's where I would like you to invite. I would like to invite you to do something. Yes, that's an area where I can intervene, and we have been very successful with what we call a BioCare health getaway. Because in many cases, people tell me, "Doctor, I have tried this diet, I have done this, I have done the other. I just don't seem to get over it. I believe me, I have done everything in the book, and nothing works for me." Well, your next vacation, come to BioCare Hospital. Spend 10 days, 2 weeks with us. And we're going to do a lot of things. We're going to work on detoxification, on general health care. We're going to change the way you eat. We are going to have a physiotherapist working with you with physical activity and advising you how to proceed. We're going to make so many changes, simple, easy to do, that people cannot believe it. And one thing I'm very happy for is for selfies. Because I used to tell people, "Oh, you know what? When you go back home, people are going to say, 'What did you do? You look so much better.'" But now with the selfies, I always tell them, make sure you take a selfie every day same clothes, same position, same everything, and then make a short film of it. And you're going to see how your face changed, how the bags in your eyes were reduced, how your complexion looks better, how your cheeks have been reduced, how everything is changing in your body. But the most important part, and once again, I'm not talking about cosmetics. The most important part is that those changes, that good changes you look in your complexion and looks are happening in your blood vessels, in your blood supply, in your liver function, in your insulin. Everything is going to be changing in your body. Those are going to be 10 days to 2 weeks that are going to completely change the body, the way your body functions. Next time you're thinking of a cruise ship, why don't you think of a BioCare Health Getaway? Then you can have your cruise ship the following year, but now you're going to be able to enjoy it a lot better because your physical activity, your physical well-being, your health is going to be much better. You will have much better ways to function. You have to embrace a healthier lifestyle. You have to switch to a healthier lifestyle because you're going to be very grateful. You're going to be very happy of all you can gain. Till next time.